It is two common drugs that is taken by millions. They have uh, they have a sudden muscle destruction and deadly kidney failure, and it could be happening inside somebody's body right now as we speak. Across the globe, countless individuals rely on cholesterol drugs, specifically atorvastatin and simvastatins. Those drugs belong to a class of cholesterol drugs we call statins. They rely on them to lower cholesterol and protect the heart and reduce the risk of stroke. It has earned trust throughout years of use and success. However, if we take just a simple or the example of simvastatin, when simvastatin is combined with a widely prescribed antibiotic called clarithromycin or azithromycin or erythromycin. Remember, clarithromycin is often used to treat respiratory and sinus infection. A danger interaction when used together can unfold quietly and rapidly. And this is what happens inside the body. The conflict begins when most medicines are processed and broken down or metabolized inside the liver. Simvastatins always depend on liver to break it down at a controlled rate. But clarithromycin block this system and process. And when that happens, the simvastatin is being prevented from being processed properly. And as a result of that, simvastatin remains in the bloodstream and raises the toxin levels. And this overload can trigger, and always they trigger a severe condition we call rhabdomyolysis. And rhabdomyolysis is a rapid breakdown of muscle tissues. The early signs may seem harmless somehow, but unusually muscle pain is what people experience, a sudden weakness, and sometimes extreme fatigue. But as the muscle begins breaking down, its content spill into the bloodstream, your bloodstream, and the kidneys attempt to filter these toxins, but they are not designed to handle this kind of mass volume. And when this happens, this leads to acute kidney failure, which require an emergency treatment or sometimes dialysis, and in the most extreme case, it can be fatal. It can be deadly, it can kill somebody. What makes this situation especially concerning is that many patients fail to recognize the symptoms. This muscle soreness is blamed on age. Sometimes weakness is blamed on work, or sometimes stress, and dark or a tea-colored urine. A major warning sign often goes unnoticed, even hours later, or every hour matters in this particular case. So here is the most important takeaway out of this video. Whenever you receive a new prescription, especially antibiotic prescribed medicine, always make sure you inform your doctor and a pharmacist of every medication you currently taking, or every medicine that is prescribed, be it over the counter or herbal drugs or herbal medicines. If you are using simvastatin, your healthcare provider must always be aware before you start clarithromycin or similar drug of that class, the class of macrolides. So this single video could protect your kidney It could protect your muscle and even your life. It is always good to be knowledgeable and aware and take control and action of your health. Make sure you share this video with someone who take medication like Simvastatin and sometimes prescribed the antibiotic that we have mentioned earlier above. So if you like this video, make sure you subscribe, share your comment in the section below, and stay informed, because the information you learn today could save a life tomorrow. So this is your health. Make sure to protect it. Until we meet on our next video, stay tuned and stay safe.